Hi, my name is Amanda, and I wanted to do a video to tell you how to survive when you're in the hospital for a long time. It can get frustrating very easily and very quickly. First, I'd like to tell you a little bit about why I'm in the hospital so much. I have an autoimmune disorder called Weggner's granulomatosis, which is very rare. It mostly affects like your upper respiratory and all that. But for me, in January 2010, I had 2 blood clots in my heart, and then in May of 2011, both my lungs collapsed, and I had to have chest tubes bilateral, which means like one on each side. But then one messed up, so then I had to have a third one. Obviously, as you can tell, I have the steroid face going. So yeah, I'm on a lot of medications for it. But when you're in the hospital, it's like different. Like everything's different. You're not home with your regular stuff, and like yeah. But tip number 1 is to ask questions. If you have them, ask them. The doctors are there to make you more comfortable. And if you're not comfortable with something, let them know. Because there's probably something they can do about it. Or somebody that you can talk to make you more comfortable of it. Like if you're going to have surgery or whatever, and you're not comfortable with it, tell them. Be like, I'm scared, or I don't want to do this. And they can like get somebody to talk to you and explain it better and like help you not be scared. But you're probably still gonna be scared. Surgery's scary. Number 2 is, if you're not comfortable with something, like I said, tell them. If you're in pain, tell them, I'm in pain, you've got to do something. Or, I don't like where this IV's at, it's aggravating me. Or, I don't like that nurse. She's not meeting my needs or whatever. Because there's usually something that can be done. It's just a matter of finding who to do it. Number 3, there are resources at the hospital that you should should use. Like, there's Elizabeth in art therapy. There's child life girls. They can get you information on diseases. They can help you cope with the diagnosis of the disease. They can get you stuffed toys. They can get you stuff to do while you're in here. There's just like, the possibilities are endless with those people. They know what they're doing. Just this week, Carrie, one of the child life girls, went on Pinterest and found some stuff for me to do. So, yeah. Check that out if you are going to be in here a while, because it's pretty cool. Another thing, with your food, if you don't like what they have, tell them, I don't like that. What else can we have? Because they have this little switcheroo menu thingy. I have one somewhere, I don't know where it's at. And like, you can get whatever you want pretty much. And you can tell them, this is what I want this, and they will try to get it for you. But the main thing is, if you're not comfortable in the hospital, which you're not going to be 100% comfortable, obviously, because it's a hospital, then you should tell somebody what's bothering you, and they can help you. I can't stress that enough, that there are things in the hospital that can help you. Another thing, family coming to visit. That really brightens your day, trust me. So don't push people away, trust me. And another thing, if you know you're going to be staying a while, bring stuff from home. Like, this is my picture of my baby girl, Lacey. My little baby girl. Oh, she's so cute, ain't she? And I brought that with me because I knew I was going to be here a while. And I miss her. But I can look at that picture and girl. She's I've had her for 5 years, and she's been with me since I got sick. 3 years ago. So she's been with me every day through that. Yeah. But do what the doctors tell you. Don't ignore it. Trust me, it just gets worse if you do. But if it's something you're not comfortable with or something, tell them there's probably an alternative to it. Again, ask questions. If you have questions, ask them. Say they bring you your medicine and there's a new pill in there that doesn't look familiar to you. Ask what it is, why they are giving it to you. Because it could be a mistake. Could not be, but could be a mistake. Another thing is just try to stay as positive as possible. And I know that's hard when you're in the hospital, but just try. Like, read a book, or now they've got the internet right on the TV. You can get on the TV and play games or go on Facebook, but keep busy. That is the main survival tip of being in the hospital, is to keep busy. When I first got sick with Weggner's, I was in here about a month, I guess. And yeah, it was the worst month of my life. They were testing and poking and prodding and yeah. But yeah. So I've spent a lot of time in the hospital. But I've learned a lot while being in the hospital. Like, you have the right to ask questions. That's the main thing. Because a lot of kids will not ask the questions that need to be asked. Because your parents may, yeah, they have their own questions, but they don't know what you're thinking or what you're feeling or what your fears are or any of that. You do, and you have the right to express them. So do that. Your opinion matters. Again, keep in touch with people. Don't push people away. Yeah, they're going to say some stupid stuff, or they're going to have a lot of questions, but that's just how people are. So don't push them away just because of that. If anything, you need to hold them near and dear, but don't push them away. And I think that's about it. So hopefully you got something from this video to help you survive a long stay at the hospital.